Hello, today we will study white chestnut. White chestnut is the remedy for a mind that refuses to rest. The person is not necessarily anxious, depressed, or fearful, but mentally trapped in repetitive thinking. The disturbance is cognitive rather than emotional. It belongs to the insufficient interest in present circumstances group because attention is hijacked by the internal dialogue. The person may physically be present but mentally absorbed in inner conversation. The defining feature is repetitive thought loops. These are not productive reflections, they circle without a resolution, and it is the core theme of White Chestnut. The central state of the white chestnut patient is the mind does not switch off. Even when the issue has no solution at that moment, thinking continues compulsively. What is the inner experience of patient requiring white chestnut? Patients often say, I know I should not think about it, but I can't stop. This loss of mental control is the key diagnostic marker. How is the emotional tone of the patient requiring white chestnut? His emotion may be mild or neutral. The suffering comes from mental noise, not from intense feelings. What are the nature of thoughts? Thoughts are circular, repetitive, often argumentative, rarely constructive. They consume energy without producing clarity. What is the key feature? There is an internal dialogue, sometimes rehearsing what should have been said or what will be said next time. How is the sleep pattern? At night, the mind replays the same theme. Sleep onset is delayed because thinking continues. What is the functional impact of these all things? Because the mental bandwidth is occupied, concentration drops, productivity reduces, even though physical energy may be normal. How is the behavior of the patient? They replay the conversations repeatedly, refining the sentences mentally. How it differs from anxiety. In anxiety remedies, fear is dominant. In white chestnut, the problem is mental repetition without necessary fear. Paradoxically, the mind is overactive yet unproductive. It is excessive activity without any direction. So, how it will affect physically to the patient? Head pressure, temple tension, and mental fatigue are common. What is the diagnostic question before deciding on white chestnut? Ask, do the same thoughts repeat automatically? And if yes, white chestnut is strongly indicated. Now we will differentiate white chestnut with other batch flower medicines. First is clematis. Clematis escapes into imagination and future fantasy. White chestnut is trapped in a repetitive loop of the same issue. Next is honeysuckle. Honeysuckle emotionally longs for the past. White chestnut mechanically replays the events without longing. Next is mustard. Mustard experiences sudden gloom without thought trigger. White chestnut has a clear thought trigger that repeats. Fourth is olive. Olive cannot think due to exhaustion. White chestnut cannot stop thinking due to overactivity. Central issue is lack of mental control, not sadness, not fear, not fatigue. Now we will compare this medicine with other homeopathic medicine. First one is Argentum nitricum. Argentum nitricum anticipates the disaster with anxiety. White chestnut repeats a specific thought without necessarily catastrophic fear. Second is anacardium. Anacardium has internal conflict, like two opposing voices. White chestnut has one repetitive line of thought. Third is natrum muriaticum. Natrum more broods over the emotional hurt, whereas white chestnut replays the content regardless of emotional depth. Fourth is Caliphosphoricum. Caliphos shows nervous weakness after the strain. White chestnut shows excessive cognitive strain. Homeopathy treats constitutional pathology. White chestnut corrects the temporary cognitive imbalance. So, what are the common situations after which patient may need white chestnut is after the argument, before the examination, before important meeting, after the unresolved discussion. What are the personality patterns who are more prone requiring the prescription of white chestnut are often intelligent, analytical individuals prone to over processing the experiences. How would child express the requirement of white chestnut? Child repeatedly thinks about teacher's scolding. How adult would express it? Adult mentally continues arguments long after they end. When we prescribe white chestnut to the patient, what should be our therapeutic aim? The goal is mental silence, creating space between thoughts. What would be the early response patients show after white chestnut is thought frequency reduces and internal dialogue softens. Later, response may be seen as clear thinking and improved focus return. Dosage is standard batch dosage 4 drops 4 times daily or as guided by practitioner. Combination in acute stress, combine white chestnut with a rescue remedy. If mood darkness is present along with the repetitive thoughts, consider mustard overlap. We should understand when this is not a white chestnut patient. If the fear is dominant, use fear remedies. It's not a white chestnut. If sadness dominates, use the depression remedies. If intrusive thoughts are severe, compulsive, or associated with self harm, immediate psychiatric evaluation is required. So, referral is recommended here. Healing means restoration of mental quietness for white chestnut. What is the key message? It's not thinking too much, it's inability to stop thinking. If this content helped you understand remedy differentiation, please like, share, and subscribe. Comment your clinical observations. Online consultations are available. You can find details in description. Thank you.